Hi, I'm Andrea Shipley, born and raised in the Bighorn Basin. I'm a fourth generation Wyomingite. The High Fidelity Wraparound program is a support for parents that need extra supports from a team of providers that can help the family get the care it needs, find respite, find resources, and find hope. When I shared with some of my colleagues that my daughter was having a mental health crisis and had been engaging in self-harm and suicide ideation, along with some attempts, they shared with me the resource of the High Fidelity Wraparound program. And the key there that they heard from me is that I needed help. I didn't understand the different levels of care that were needed in different stages of a mental health crisis. The High Fidelity Wraparound program had an incredible impact on our family. One, what are the needs of our child and how can we reach those? Of course, there's no manual to parenting, but then you add in any extra barriers, and especially a mental health crisis, it was really difficult to know what psych hospitals should this child go to? What are the residential programs, partial hospitalization programs? How do we deal with the schools? What is an IEP? What is a 504 plan? What are the resources within the special education program through the Department of Education? Who are the point people that deal with those in both elementary schools and in middle schools? And what you find is sometimes even, our educators who work so hard for our children don't know these resources. And so really telling Wyoming that there's this program that can help folks navigate what is a very emotional, very tumultuous issue is so important. So our immediate household within the wraparound program was all in. My child meets weekly with someone from the wraparound program, as well as I meet with someone weekly from the wraparound program. My husband steps in and gets needs met as well. High Fidelity Wraparound program is essential. The reason why is because parents need help. How many providers is your child going to need based on the sort of complex health needs that they have? And where are you going to find those specialists? And how can you best meet your budgetary and family needs? What parts of the services can you receive over telehealth? Are those ethical and effective for your child at this point? These are huge questions, and more questions than that pop up all the time. To have a team to be able to run those ideas off of and make a plan as a family and as a group of protective forces, along with your pediatrician, is essential to really protect and grow healthy families in the state of Wyoming.